Hello, this is Rashi Sahai, and you're watching Medicircle. Today, on our cancer awareness series, we have Dr. Shiva Kumar Upala with us. Dr. Shiva Kumar is a surgical oncologist in Bengaluru and is currently practicing in North Bengaluru Hospital. For the past 14 years, he has worked as an oncologist and is a member of Indian Association of Surgical Oncology. Welcome to Medicircle, Dr. Shiva Kumar.
Thank you very much. Hi,
India
everyone.
ranks third in cancer cases after China and US. Every year, India reports more than a million new cases of cancer. Among them, 500,000 deaths happen due to the ignorance of the disease. And so, let us understand about cancer from Dr. Shiva Kumar Upala. So, doctor, can you please tell us that what are the signs and symptoms of cancer?
Okay, cancer is not a single disease. We have a lot of there are 1,000 different types of cancers in the human body. So symptoms are very much specific to each cancer. So we cannot generally say this is a sign for every cancer. But usually we see cancers in elderly or sixth or seventh decade. So there are we see children also, but not commonly I'm telling it is elderly. And most of the most common generic symptom what we see is loss of weight that is unexplained without any intentional dieting or anything, especially more than 3 kgs in last 3 months or more than 6 kgs in last 6 months is one of the main important symptom. Other than that, the loss of appetite, that means not feeling like eating. They want to eat when they see the food. They don't want they will feel they will not feel like eating the food. And other most common is generalized weakness and vague symptoms. They will not be able to pinpoint this is a clear cause, clear symptom. So they feel not feeling well. And specific to most common cancers, for example, in India, we see in female cervical cancer is the most common. In that we see there's a bleeding from the vagina that is either post-coital bleeding, that is after sexual intercourse, they may experience the bleeding, or in between the menstrual cycles, not during the menstrual period. And then the most important and very uh, uh, important symptom is post-menopausal bleeding. Any woman, once the menses stops and after that any amount of bleeding is to be taken very much seriously. 90% of the chances it might be due to a cancer of the cervix or endometrium of the uterus. Other common cancers are breast cancer in women. So they may feel a lump or swelling in their breast, and sometimes it might present with a discharge from the nipple. It need not to be a bloody discharge. It can be whitish or it can be greenish, any color of discharge. And there are sometimes a lump or swelling in the axilla or armpit. And whenever the cancer is in a advanced stages, you may see bone pains and the back pain, and the jaundice is one of the symptoms, and ascites or distension of the abdomen. So these are some of the symptoms to mention.
Okay, doctor. So, what are the causes of cancer?
Cancer as such is a multifactorial in causative factors. So that means one is very important is genetic makeup of the body is one thing, and then the hereditary risk factor is there, wherein the some cancer causing genes are transmitted from generation to generation, and there are also genes which can in individual person can become carcinogenic or cancerous. That is called idiopathic or somatic mutation, which are not hereditary. Other than that, our regular daily to day activities like what you breathe, what you eat, that is more important. What you work. Nowadays, air pollution in Indian cities and urban population is most commonly affecting the young individuals with lung cancer, and other than most of the younger becoming addicts to the alcohol and smoking and tobacco related products, and it is one of the most important, and it is a more common causative factor for almost all the cancers. So smoking is there; it causes all cancers of the body. For lung, you would say lung cancer, stomach cancer, pancreatic cancer. So, and some have a notion that smokeless tobacco, that is what tobacco chewing will not cause, only smoking will cause. But that is untrue. All these tobacco products like gutka, chaini, all these cause cancer in the oral cavity, pharynx, and stomach, esophagus, or pancreatic cancer also. And chronic alcohol dependence and alcoholism is a causative factor for so many cancers like liver cancer can happen, and stomach cancer, colon cancer. And there are some endemic causes as well. There are some areas where are more prone for some cancer. For example, coming to northern Karnataka, we have more of a esophageal cancers. When you go to North India, we see more of a gallbladder cancers, and upper GI cancers are more. And regular diet also plays an important role, because we see some cancers more common in the urban population compared to rural population. Breast cancer, ovarian cancer, they are linked to the obesity. Person is more obese, there are more chances of getting breast cancer and ovarian cancer and also colon cancer. So maintaining a healthy lifestyle and habit is very important. And hereditary, as I told, where 15 to 20% of the cancer cases can be attributed to hereditary. And apart from this, there are some infections. For example, stomach cancer will be caused by H. pylori bacterial infection. And most common cancer in the world and India is cervical cancer, that is caused by a virus called human papilloma virus. And 99% of the cancers are attributed to the virus, which is contracted during the sexual activity. So we do have a window of opportunity to prevent that before the exposure. At the age of 10 to 12 years, if we can vaccinate or immunize the woman with HPV cancer vaccine, there's a possibility we can prevent the most common cancer 100%. So these are the few causes to say.
Okay, doctor, can you please tell our viewers that what are the different stages of cancer?
So generally, we divide cancer into four stages. That is stage one, two, three, and four. Stage one is where the cancer where it started. It is limited to that organ. For example, it started in the breast. It is the initial stages where it is up is 1 centimeter, 2 centimeter. It is limited to the breast. And stage two comes where the cancer in the breast is of larger size, maybe more than 4 centimeter, 5 centimeter. Also, it has spread from the area of origin to nearby organs, for example, armpit and axilla. This is usually stage two. Stage three is extensive spread to the local area. For example, there are 10 lymph nodes. If it is spread to only one, it will come under stage two. If there are 4 5 lymph nodes, it will come under stage three. And extensive involvement of the local area also. If it is ulcerating, the whole breast is involved. And whenever this cancer has spread beyond this and this local area to other parts of the body, for example, it has gone to lungs, or it has gone to liver, or it has gone to bones or brain. This is called systemic spread of the cancer or metastasis. This stage is called stage four. These are the four stages. Generally holds true in almost all the cancers.
Okay, doctor. So can cancer be called as a genetic disease?
Yeah, as I was mentioning, there are chances of 10 to 15% being transmitted by generations in the genes. So it is a genetic disease, but not all cancers are related to the hereditary or genetic risk factors. So basically, cancer itself is a variation in the gene level. There is some mutation. So, but hereditary component or genetic component is seen 10 to 15% overall. I'm telling generally.
So, doctor, as the cancer cases are increasing nowadays, so how often should we go for the diagnosis so that it can be early detected?
See, there are standardized guidelines to follow to detect the cancers early, and it is different for different individual based on the risk factors. For example, a smoker will need to do a lung CT test every annually. Non-smoker we don't usually advise like that. Whoever is in a higher risk factor, or somebody example family member has a breast cancer at the age of 40 years, we advise the children and siblings to undergo testing starting at least 10 years before that age, like 30 years she has to start the testing. Overall, for a normal average risk individual, at least there are some tests which have to be done at least once in a year, and there are some we can do in once in 5 years. For example, colonoscopy we need to do every 5 years, and other tests like breast we have mammography we need to do every annual, cervical pap smear every year, and fecal occult blood testing every year, and colonoscopy as I told is around 5 years. And in clinical examination is a part of screening for especially tobacco chewers, intraoral examination at least once in a year. So generally, annual one screening examination for all the cancers is adequate.
Okay, doctor. So on Medicircle, our main focus have always been to provide more information to the audience in less time. And so today we will be conducting a small quick question answer session in which you can either answer in yes or no or a one line to answer.
Yeah.
Yeah. So my first question is, doctor, does hair dyes and deodorants cause cancer?
There is a chance of developing cancer. There are chemical carcinogens. Yes.
Okay. So does excessive sun exposure can also cause cancer?
Yes, definitely. Yes.
And it is said that drinking from plastic bottles cause cancer. So is it true?
There is no definitive proof that it will cause cancer, but there is a possibility. I cannot conclusively say rule out that.
Okay, doctor. Thank you so much for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having
Thank
you
you.
on the show. Thank you so much.
Thank you. Thank you very much.